Welcome to Friday's coverage of COVID-19. I'm Min Sun Hee. Cluster infections at nursing homes and rehabilitation centres are fueling a disturbing rise in cases. What's more, reports of fatalities following flu shots are raising public alarm about the safety of the vaccination campaign. Now, we have more on that later on in our program. First, here is our Kwon So-ah with the latest numbers on the pandemic. So let's start with the situation here in Korea, where there has been an alarming surge in infections, I hear.
Right, Sunny. For the second straight day, Korea again reported a number above 100. And it's been less than 2 weeks that the country has returned to social distancing measures at level 1, but it is a third time that we are seeing triple digits during that period. And if we go over to our graph here, we do see an upward trend for the past 3 days. And if we compare the figure to last Friday, when we headed into the weekend with cases below 50, that is a threefold jump on weeks. So this is a concern right now. And this also is a concern because we have 17 imported cases, the same number as yesterday. And that means that the number of domestic cases has increased quite a lot here. And this brings to Friday's total cases to 155, raising the total figure to almost 25,700. We also have 2 deaths, raising the death toll to 455. And the number of people in quarantine has surpassed 1,500, while we have around 23,700 recoveries.
I see. So I understand the latest surge is largely linked to medical facilities.
Right, Sunny. And the biggest concern with outbreaks at such facilities is, especially those specializing in elderly care, is that many patients already have underlying conditions and are in the high-risk age group. Now, at Friday's morning government briefing, senior health official Yoon Tae-ho said that many of these medical facilities are already abiding by stringent quarantine measures, but called on even more thorough efforts. Let's take a listen.
We ask you to refrain from making visits to nursing hospitals and nursing facilities, among others for the first time being, as COVID-19 is continuing to spread at these places. Disease control supervisors should be designated at each facility, and for workers who develop a fever or show respiratory symptoms, they should be removed from their line of work and get tested for the virus.
So if we take a look at where these new cases emerged, we have an alarming figure here in Gyeonggi-do province, over 100 cases, and 98 of these were domestic infections. And that includes another uptick in cases related to medical facilities, such as a rehabilitation facility in Gyeonggi-do province. Also 20 new cases in the capital, Seoul, 5 in Incheon, and also in total, a little less than 10 regions or cities have been affected with new infections on Friday. And as I mentioned before, 17 cases were categorized as overseas infections, including 6 from the U.S. And speaking of the U.S., let's take a look at the global figures. Resurgences here in the U.S. again, with some 76,000 new cases and around 1,000 deaths a day. And also in Europe, many European countries are still dealing with exponentially high figures here. France is soon to have 1 million cases, similar here in Colombia. And if we move over to other places in Europe, a concern here in Germany, which just surpassed 400,000 cases. For the second straight day, this country is seeing another record high figure with 12,000 new cases, and the death toll having surpassed 10,000, also having surpassed Bangladesh. Well, Germany was just added here in the top 20, so we can see how fast the virus is spreading in European nations, and that also shows how the global figure is getting higher and higher. Here, a really concerning figure we're seeing here. As of noon Korea time, we have over 507,000 new infections reported in just 24 hours. And during the same span, we also have almost 6,400 fatalities and around 273,000 recoveries. And those are the updates I have for now. No government briefing in the afternoon on Fridays, so I'll be back with more updates next week. Stay safe, and back to you, Sunny.
All right, so thank you for that. I'll see you next Monday. Right, staying on the international front, authorities in Hong Kong are keeping a tight rein on COVID-19 as the region has so far recorded slightly more than 5,000 cases and some 100 fatalities. I have John Power, a journalist based there in Hong Kong, live on the line. Welcome, John.
Thank you for having me.
Right, so John, how are authorities there been able to keep a leash on the outbreak?
Well, today health officials reported 4 cases. All of but one was imported. That comes after 8 cases yesterday and 11 the day before that. And also in all of those cases, there was just one locally transmitted infection. So the situation here in Hong Kong has certainly stabilized a lot. It's looking quite positive and quite under control. And in many ways, life is going on as normal. There were earlier restrictions on bars and quite strict restrictions on the opening hours of restaurants. Gyms, places like that were also closed, and those restrictions have been eased in the last few weeks. And at this point, there are some restrictions on groups of people eating together and things like that in public gatherings. But overall, the situation is quite stable. I think authorities here have been following the playbook that has been used really internationally and has been learned from over the last year of quarantine, isolation, testing, and those sorts of things like that. And obviously, the international arrivals into the city is very tightly controlled. I also think there's a sense here that the population has been very sort of responsible. In a personal way. There's memories here of the SARS outbreak in 2003, and really from very early on, people were wearing masks, they were taking precautions, and I think that has made all the difference, and so far the city has handled it, I think, overall quite well.
I see. John, you wrote an article that details Korea's response to the pandemic. Could you tell us a bit about that article?
Sure, yeah, well, I think Korea is a very interesting case because it has provided quite a unique and it would seem so far successful model for tackling the pandemic. Very few countries have managed to keep infections and fatalities low and at the same time keep the economy in a healthy shape. And Korea so far seems to be among a very small number of countries that has done that. The economic projections for this year are a relatively mild recession. I think 0.8% contraction is the OECD prediction. And at the same time, there's been fewer than 500 fatalities. So all around, that seems to be a very successful approach so far. And Korea obviously has very specific and well-developed infrastructure, again, learned from past pandemics with digital surveillance and contact tracing. And it seems to have worked out very well. I think it's going to be interesting now to see how other countries can learn from that, or whether they will, because I mean, now in Europe and in a lot of the Western world, countries are talking about returning to quite harsh lockdowns, and Korea, for the most part, has avoided a lot of those restrictions. And I think it's interesting to sort of compare those responses and maybe ask why authorities can't sort of balance those competing needs better than they have elsewhere.
Right. Now, like their counterparts in Korea, authorities in Hong Kong are seeking to thwart a twindemic by urging members of the public to get their flu shots. Please tell us a bit about this campaign.
Yeah, well, we're coming up to flu season, which is a significant public health event in normal times anyway. And actually, the demand for the flu vaccine has really shot up in the last few weeks and months. The doctors around the city are reporting shortages. And then, of course, the bigger question is when we'll have, a vaccine for COVID-19. So obviously, there's a need to sort of not add to the situation with, excess flu infections as well. The city here, like, the rest of the world, we're waiting on when there's going to be a breakthrough. Authorities here have suggested that there could be some sort of vaccine available by April. I think like a lot of governments, there's different avenues that people are looking toward to get a vaccine, whether it's buying directly from the manufacturers or working with some of the consortiums under the WHO to get a vaccine if and when it becomes available. But yeah, I mean, like a lot of places now, we're heading into this situation with the flu, which, is a potential complicating factor. So that's something that, officials are paying attention to as well.
John, despite the relative safety from the pandemic, I understand people there are nonetheless suffering from the psychological toll of COVID-19. And this is a reality that your paper recently covered. Could you tell us a bit about that as well?
Yeah, well, I think like people everywhere, this pandemic and this year has had a psychological toll. It's a time of uncertainty. It's a time of, economic hardship. People are being put out of work. People aren't able to visit friends and family so easily. And there's sort of a daily, barrage of statistics and figures from officials and media about the situation. So it is certainly difficult, and charities in Hong Kong have been reporting that there has been a massive uptick in, people reaching out for help, reporting mental distress and, serious mental health issues. It's certainly a problem, and also it seems to be particularly concentrated among young people here. The Samaritans, which of course is a very well-known charity that works against suicide, has reported that about 75% of the inquiries it's receiving over email are from students. And, they've also been dealing with school closures at various points during the year and being isolated from friends and things like that. And obviously, looking forward to a very difficult job market, maybe for even potentially months and years to come. So, I think it's a tough time for people here and just around the world in general, of course.
Right. You mentioned the economic toll, and it is that particular toll that has Cathay Pacific poised to slash its workforce, I understand, by almost a quarter, and to shutter its short-haul airlines that would be Cathay Dragon, right?
Yeah, the Cathay Pacific is cutting almost 6,000 jobs, and they're actually shutting completely Cathay Dragon, which is the airline focused particularly on mainland China. Obviously, it's a major blow to the city that's going to have very significant knock-on effects. A lot of people who work in the airline industry live in Hong Kong, so there's all sorts of potential ramifications from that in terms of house prices and the broader economy. Like almost everywhere, Hong Kong has suffered economically. It's a very open economy. It depends very much on things like tourism, which has completely dried up because of obviously the border restrictions, and that has knock-on effects for retail. Hospitality, hotels, bars, restaurants, those kind of industries have really suffered. In the second quarter, we saw the economy, GDP drop 9%, which followed on from a similar contraction in the first quarter, which itself was, the biggest decline in GDP since the mid-'70s, since records began to be compiled. So it's obviously a very serious situation, and, Hong Kong, like most other jurisdictions, has not been able to sort of escape the economic impact of that. We've also had unemployment rise towards about 6.5%, which is, a 16-year record, and that could rise further as some of the government subsidy schemes for keeping on employees are rolled back. So it's certainly been a tough time economically here as well.
Right, and that is the reality for the rest of the world as well. All right, John, thank you for making the time to talk to us live.
Thank you.
Right. Back here in Korea, the Cultural Heritage Administration has reopened more than a dozen indoor exhibitions under its management amid level 1 social distancing, nationwide that is. Now I have our Chun Song-cho at one such exhibition. Hello, Song-cho.
Good afternoon, Sunny.
So I hear you are at the National Palace Museum, Song-cho.
Yes, I'm at the National Palace Museum of Korea in Jongno-gu District. It's one of the 14 public indoor facilities that have reopened recently after the South Korean government lowered the social distancing guidelines to level 1. This museum is actually located inside the famous Gyeongbokgung Palace. So follow me, let's take a look inside. It houses over 40,000 artifacts and royal treasures from the palaces of the Joseon dynasty of of which 14 have been designated as national treasures of South Korea. Permanent exhibitions have put art and household goods from the court, as well as paintings and calligraphy from that era on display. And what you're seeing right now is a special exhibition that's going on until November 1st. It's titled New Era of the Royal Ceramics, Embracing the Western-style porcelain in the Joseon Royal Court. So you see all these mesmerizing, beautiful ceramics and vases. So you can really get a glimpse into the hundreds-year-old culture from the Joseon dynasty. Well, actually all for free as well. So it's no surprise that this museum is arguably one of the most popular museums for Seoulites as well as tourists. But you may notice this place is not as crowded, at least as what it's used to, because just last year, the average number of daily visitors was about 4,000. But after COVID, the museum is only allowed to accept 1,000 visitors at most per day. And also to ensure that those visits are evenly spread out throughout the day, so that not too many people are crammed into the exhibition rooms all at the same time, the museum has set the 130 persons cap for every hour. Visitors without a mask on or with temperature above 37.5 degrees Celsius won't be able to enter the premises at all. And the museum has hired a special disinfecting team to sterilize the entire place at least twice a week. So these are just some of the safety measures, the steps that the museum is taking right now to ensure that the place remains virus-free. But regardless of how safe it may sound or look, you may still want to stay at home and be able to enjoy these exhibitions at home. Well, in that case, you can check out the VR exhibitions on the official website of the museum. You can get an immersive experience that will make you feel like you're actually here without physically being here. So you will be able to wander around and explore into every nook and cranny of the facility, all virtually, with the audio guide also provided that will give you all the descriptions and historical backgrounds that you need for every artifact that you look into. Well, yes. Social distancing guidelines have been eased, and museums and galleries around the country have started to reopen. But let's not too get excited and not too carried away by this moment, and let's remember that we can still enjoy culture, art, and history in a safe manner as long as we strictly follow the safety guidelines that are in place. This has been Chun Sung-cho reporting live from the museum, and back to you, Sunny, in the studio.
All right, Sung-cho, thank you for a glimpse of that exhibition and for that coverage.
논의한 결과 백신과의 직접적인 연관성 그리고 예방접종 후 이상 반응과 사망과의 직접적인 인과성은 확인되지는 않았으며 질병관리청은 신속하게 역학조사를 통해 예방접종 인과관계와 원인을 조사하도록 하겠습니다.
It is, though, sad to see many countries in Europe experiencing a rapid rise in cases, and governments do have to take decisive action in order to try and shut down transmission.
Reports of fatalities following flu shots are triggering much public fear, as is the rising number of imported cases amid the resurgence in Europe and in the US. Now, for more on these concerns, I have Dr. Yoo Byung-wook from Soonchunhyang University Hospital. Welcome back, Dr. Yoo. And I also have Dr. Alice Hyung-kyung Tan from Ms. Medi Women's Hospital. Pleasure to have you back, Dr. Tan.
Thank you for having me.
Dr. Dan, following the first case last Friday, I believe, of a 17-year-old boy as his death after getting his flu shot, I believe, on a Wednesday, we've had at least 32 such related or reported fatalities in a span of a week. Now, have there been cases of deaths following flu shots in the past as well?
The influenza vaccine is considered very safe. According to Commissioner Chung, since 2009, 25 deaths have been reported. However, only one fatality was actually proven to be associated or attributable to the influenza vaccine. And so in terms of deaths, they have been very rare indeed. Normally, we see about 50 adverse effects reported per year due to the influenza vaccine. In 2009, 2010, when we had the H1N1 pandemic, there was a surge in reports of adverse effects, but usually it's about 50. In terms of actual adverse effects, there have been 12 cases of what's called Guillain-Barre Syndrome. And that's a neuromuscular acquired disease in which the patient becomes very weak. There's coordination problems, and they lose what's called deep tendon reflexes. That's what's known as a knee-jerk reflex, I think you will know. So 12 cases since 2004. That's millions of doses of influenza vaccine. So we know statistically it is a very safe vaccine. And only one fatality really has been attributed. Still, 30 cases in the last week or so, that is a high number. We do need to wait for, I think, the autopsy studies to be released. And that 17-year-old patient that you're referring to, I understand that his case is currently undergoing autopsy. And so we will wait to see what that report shows.
Right, Dr. Yu, as Dr. Dan just mentioned, investigations are underway, but what are your thoughts on these unfortunate losses of lives?
Well, first of all, I'm so sad and sorry about all the people who related the deaths. And what Dr. Dan mentioned about it, since 2019 until now, before it happened, only one case is confirmed by Korean government. But other cases also highly suspicious the vaccine related, but in general, the vaccine is safe. But problem is this year, we prepared more flu vaccination than last couple of years. That time we prepared more material from the eggs. Also other material should be preparing more than before. That time we have to be invested about the material which is made for the vaccinations. The second is that cold chain issues already but the government said was safe. I still believe about it. But some of the products, vaccine product, should be postponed until make the complete to the safety. Because my concern is even the young people who can pay for themselves for the having vaccination, they now denied. They don't want it. And they can influence to their parents who have to done to flu vaccination, they'll be hesitated. Why? Everything not clear. So usually the death we cannot be defined exactly what exactly. The one example, person who had a diabetes long time, but one day suddenly God called him or her to heaven. So we don't know exactly it came from the heart attacks or just kind of spontaneous death. We don't know because even the autopsy is done, we don't know. But while we waiting for the autopsy of the two cases, but the government and the expert group should be claim about the process of the manufacturing of the all vaccines from the material, the eggs, processing, other machinery, stabilizer, and any material can be toxic, reactive for vulnerable people.
I see. So is the flu vaccine, so the flu vaccine itself contains amounts of egg protein because it's cultured in eggs?
Yes. So traditionally, the flu vaccination and other vaccination also made from the eggs. But to this day, we have two different flu vaccination available. Cell culture is non-egg related and egg-based. So effectiveness and efficacy is nearly same, but process, the cell culture breeding is we can make it rapidly and it no need the eggs. The egg one is so it's potentially more effective, but there are different eyes of some experts because some eggs can develop as like the resistant specific virus. At the same time, eggs should be stabilized. We have to use eggs while we preparing as material for the flu vaccination. That kind of stabilizer and some material can be reacted to someone. That's why we recommend that you have the serious egg allergy before, better to avoid or better to postpone or be consulted with the expert or the doctor's group before have a vaccination.
I see. Okay, having said all that, Dr. Dan, should we still get ourselves vaccinated against the seasonal flu?
So that's the $6 million question, right, that everybody wants to know. Is it safe? Unfortunately, there's not a consensus among all the medical experts. For example, the Korean Medical Association asked its member physicians to hold off on administering the vaccine for a week until October 29th, until we get some more information. However, the KCDC and the Korean Vaccine Society, they have urged people to go ahead and get vaccinated, that it's safe and that they shouldn't worry. My personal opinion is that although the vaccine is probably safe and temporal relationship does not prove causality. In other words, just because someone got a vaccine and then they died, say, a few days later, it does not prove that the vaccine was the cause of death. However, there's some reasons why I think perhaps waiting and seeing a little bit may be a good idea. First of all, there have been 0 cases of influenza documented in Korea over the last 5 weeks. We did not see influenza in the spring either. In other words, the prevalence of influenza in Korea is very low right now. Usually the peak starts at the end of November, first week of December. It takes about 2 weeks to get immune. So there is a little bit of time that we can wait before people should get vaccinated. The other thing is actually a lot of vulnerable people have already gotten the vaccine. So among children less than 12, already 70% of those children have gotten the influenza vaccine. About 1/3 of pregnant women and elderly people have gotten vaccinated, and about half of children between 13 and 18 years of age have gotten vaccinated. So waiting a little bit until we get some more information, I think, may be prudent. And the last thing is, it's actually very important for people to feel safe, to have trust, to have confidence in a preventive measure or a therapeutic, say, medication, because it's not just a placebo effect. You need to feel good about the treatment or the preventive measure that you are receiving. And I would like for Korean people to feel that confidence that it's safe for them. I think ultimately it will be proven to be safe. Waiting, I think, a little bit, as the Korean Medical Association has recommended. I don't think there are many harms to that strategy.
Right. Dr. Yu, just out of curiosity, and without, of course, seeking to raise any unnecessary alarm nor cause any speculation, but do you believe the improper storage of the vaccines perhaps could be a possible cause for the latest events?
So it can be, but I can tell now with the evidence and announcement from government, I can say no. Why? Because some of the suspect already withdrawing and it destroyed it. So we're not exposed from them, but I can suspect one, because how we can confirm the 100% they was inspected, all the product for the pre-vaccination is prepared. That's why, so clearance message from the government and authority part is very important, because people are we are afraid, even me, because I'm also human beings. So, which means the people under the certain pressure, uncovered through the fear. Actually, what Dr. Dan, he told us, also I believe the flu vaccination saved, but the message are not clear from the government side. People are still hesitated. So storage and kind of cold chain issues, it was happening. Kind of consequence. So the cold chain, storage issues, really persons die. So what is next? So people are worried about it. But next week, we can postpone just a little bit of the time and make a clear message till the early of the next week. And we will encourage them to go to flu vaccination before flu is coming.
Dr. Dan, after receiving a flu shot, are there any symptoms that we can look out for that would be an indication perhaps of the onset of an adverse reaction?
Well, hopefully not happen. We can call anaphylactic shock. Anaphylactic shock means immediately happens. So immediately happen means after the administered injections, within the 30 minutes is the choking, couldn't breathe properly, and the dropping their blood pressures, and the fainting, and happen some. Or sometimes the rash is coming, but anaphylactic shock means life-threatening condition. But it happened because of the phobia of the needle, who in the shock for even just to see the needle. So usually we recommend for any kind of vaccination, but especially this period, please stay in the service area or in the hospital at least 30 minutes, check your temperatures and respiration and feeling of the heavy head or dizziness and the heavy chest. If you feel good and the right body, you can enjoy the back to home. So let me say, before you go to the vaccination, please take care of yourself well. Temperatures, any symptom of the upper respiratory, like the cold symptoms, aching bodies, and uneasiness of stomach. But if you're well from them, go to have a shot. After shot, please take care at least 30 minutes in the facilities and at least 24 hours, take care of yourself. And you can bath, but right, no drink, and no the physical activity for at least 24 hours, please.
Right. Dr. Tan, I'd like to direct your attention back to the pandemic now. As of yesterday, Korea has been witnessing 3-digit figures amid cluster infections at nursing homes, rehabilitation centers, and so forth. What are your thoughts on the latest events?
Right. So whenever we hear triple-digit numbers, we get alarmed. However, the bulk of the new cases have come from already established clusters in, as you mentioned, long-term care facilities such as rehabilitation, psychiatric care, and convalescent hospitals, also nursing homes. I think this highlights the fact that this vulnerable population needs to be better protected in our country. So we do need to step up on infectious disease prevention and control measures. I think the policy of preemptive screening needs to be continued and maybe followed on a regular basis, sort of routinely, so that we can try to find asymptomatic carriers, perhaps among staff and residents at these types of facilities. It's unfortunate because we know that these types of patients are at the highest risk of the serious adverse effects. And so, we rightfully anticipate that we will see more deaths related to COVID-19, unfortunately, because of these clusters. However, we do need to, as I said, step up, not just the preemptive screening, but I think also the decontamination and disinfection that's going on for the common use equipment. And anytime equipment or personnel, they're coming in from outside, I think they do need to be screened and make sure that they're safe before coming in.
Right. And speaking of what Dr. Dan just said, Dr. Yu, large-scale screening has started in the metropolitan region, though, for these nursing centers and these facilities that accommodate the elderly. Do you suppose the rise in cases recently is owing to these large-scale testings?
Yes, I agree about it. So many experts, we expected that this week, because last week we thought, oh, probably the 3-digit number was coming and realize it. But we have to see the two different visions, because just the communities to the under silence spreadings also is kind of the harm thing. But what Dr. Dan mentioned, so who are vulnerable peoples who need long-term care, there could be victims. So we have to be in advance searching to who need help and the kind of quarantines for the grouping. This was very necessary. The government and the KDCA, so they advanced, we are welcome. So please, dear audience and watching the Arirang, don't be surprised about the 3-digit numbers, because we have to see difference. In the common communities, still not that much, but it's the kind of the cluster infection we found it in the facility which is closed. But I was still welcoming about this advanced research, advanced searching about the patient who can be the unsymptomatic infection, because it can be prevented, the number of deaths to be prevented.
Right. Dr. Tan, on the global front, the world has now more than 40 million cases, and the pace of infection is alarming because from 30 million going up to 40 million, it took us about a month. Now, just for the sake of comparison, I might add that the first 10 million was reached about 120 days after the initial case in Wuhan. What are your thoughts on this alarming pace of infection?
Right, so we're still in an acceleration phase, unfortunately, in the United States, Europe, certain countries in South America. Unfortunately, daily new cases are on the rise. The epidemic curve, however, looks very different for each country in the top 10. For example, the United States, they do seem to be in now the third wave of COVID-19, whereas for Spain, the first wave never really ended. It's just been an acceleration since the beginning. France, however, their second peak that's going on right now, it's about 5 times the peak that they initially reached. So it's a 2-wave pattern. The acceleration and the increased number of positive cases, I don't think it's just a factor of more testing. I think it is symptomatic of not enough testing and not enough in terms of public health measures that were taken. And I say this because in the majority of the states of the United States, the test positivity rate is greater than 5%. In other words, it's not just because you're testing more, it's because there are more cases that need to be diagnosed. That's why we are seeing an increased number of positive cases. And it just shows, I think, that there was a failure on the part of many countries during lockdown to implement the kind of intensive infectious disease prevention and control measures that in Korea we have now made part of our daily lives. So the testing capacity needed to be ramped up. The tracing and isolation capacity also and infrastructure needed to be put in place. And then, of course, the most important, the education and engagement of the public that really needed to happen, and that just didn't, unfortunately, in some of these countries. And so that's why we are seeing, in my opinion, this increase of cases. It's not too late, I think, to implement these measures. Unfortunately, some of the communities and regions that are seeing overwhelmed healthcare systems, they are having to go into lockdown. And unfortunately, that's a last resort. But when you don't have enough beds in the hospital to take care of all the sick patients, unfortunately, that's kind of what needs to be done in the short term. It's like calling a ceasefire during a war. But for the other countries, I think this really does need to be a wake-up call to really do what needs to be done in terms of the tools and techniques to get COVID-19 under control.
Right. Dr. Yu, perhaps as a reflection of the resurgence across the world, here in Korea, imported cases have been on the rise. Now, what challenges does this reality pose on Korea's containment efforts, do you think?
Well, some people from the beginning of the COVID-19 crisis, why not Korean government not lock down in all the country? But this is impossible because Korea is a trading country. If we lock down, we cannot survive. So we still open our airport at the port of Harbor. But you can guess, you just arrived in the Incheon International Airport. What is the first? You will be submit the special quarantines and self-reported. And they will, meanwhile you wake up, working in the corridor in the airport, they will help to the lines to quarantine and should be install the application in your mobile, and then it starts with the tracing. At the same time, you have opportunity, the chance to be stay in the nearby airport or your home if you are Korean. So within 24 hours, at least 72 hours after arrive, you have to be done and test should be reported in government is negative or positive. Case of most of the cases negative should be stayed 14 days, very strong the quarantine, and one Korean officers with the match with the app, at least one or twice a phone call, and wherever the tracing where you are, and then exactly 14 days complete, and the test done, or in the case or not. And how do you think about that? this is kind of perfect quarantine and train system. If you out of this rule, it's this. So we will prepare already. Some of the points that they are leaking and some people are escaping, but we have it prepared like this. If we're sharing more about the port of harbor for the mass of the transporting from the shipping, we will prepare about it. There are no problem to keep on, even among these crises in the world.
Right. Meanwhile, Dr. Dan, over in the UK, the country that is appears to be taking a drastic approach in its pursuit of a vaccine. It has started what is being called the Human Challenge trial. Could you tell us a bit more about this trial and about the controversy surrounding it?
Right. I think at the outset, for people who are not familiar with this, it may sound intuitively unethical to purposefully infect an adult with COVID-19. However, this type of trial, a challenge trial, has been used over the last 50 years to help with the development of vaccines for cholera, typhoid, and influenza. And if it's done correctly, it can be safe. Now, the reason why it's so controversial for SARS-CoV-2 is because, one, we do not have any proven treatments for the disease, and also, two, we don't have a full knowledge of the pathogenesis of the disease either. There are four reasons for why a human challenge trial would be done. The first is if you understand what a typical phase 3 trial involves. Basically, you're enrolling thousands of healthy adults. You randomize them into two groups. One group you give the vaccine, the other group you give a placebo. You have them return to their community, to their normal lives, and then you have to wait and see. It takes a lot of people and a lot of time to get the kind of results that we need. However, with the challenge trial, it can accelerate the development of a vaccine. Also, it can increase the likelihood that a candidate vaccine will actually go into development and ultimately become available to the public. The third reason why we would do a challenge trial is it could validate tests of immunity, because that's a lot of mystery around, are people actually immune? And then the last reason would be to improve knowledge about SARS-CoV-2 disease infection and transmission. So there are four definite reasons for why such a challenge trial would be used. In terms of the population, it would be probably in people aged between 18 and 30, the young population, because they seem to be at lowest risk for adverse effects. They would need to be healthy as well, and of course done under informed consent and under very close monitoring and scrutiny. And so even though it does sound very odd, it has been done in the past, and the WHO has been looking at this since May as a possibility.
I see. But surely they don't represent the majority of the public, because they are young and healthy. Most of the people vulnerable right now are the elderly.
I think this would be done as an adjunct to the clinical trials that are ongoing. And it just adds some more information to give us confidence that once a vaccine is developed, that it is safe and effective.
Right. Okay, Dr. Yu, we are ushering in a new weekend right now. And what are some measures, in your opinion, for members of the public to keep in mind as they wish to catch some fresh air, if you will?
Well, so the weather is better, but on welcoming the yellow dust started together. So people should be wear a mask well, because there are two reasons, not only COVID-19, and on welcoming the yellow dust started from a couple of days before. So we have two phases, because we are open now at stage 1, so open more. We have more opportunity outskirts of the Seoul and anywhere to the place, and also, it's a voucher, discount voucher started. We have a more opportunity to go to CinemaScope, anywhere. But so such as number is coming in television and in the media, we have to see the two different vision. One for the long-term facilities numbers, one for the community. If you have more than 200 or more than 250 number confirmed case of the day, mean probably happen both. But more than less around 100 mean 50 or 60 for case for long facilities, and other is our communities. So anyway, keeping a social distance, even though our level is coming down. The wear mask, not only COVID-19, and kind of yellow dust, not invited friends is coming a little late, but wear mask is the only one way we can, even among the we were afraid about the vaccine crisis.
Right, wear your mask then. All right, Dr. Yu, as always, thank you for your thoughts. And Dr. Dan, thank you for being with us today.
Thank you.
Right, on that note, we end this week's coverage of COVID-19. Now, the weather has gotten colder, and remember to layer up and also, of course, to wear your mask when you go outside, as our Dr. Yu has said. Have a safe weekend. I'll see you on Monday.